everyone. Welcome to this week's Gaslit Nation bonus show, which is the taping of our live interview with Dr. Meena Butra, a physician with Doctors for America, on how we're going to fight to protect our healthcare. This conversation includes questions from Gaslit Nation listeners and our Patreon community who were in the Zoom salon on Monday with Dr. Butra, asking their questions and sorting through our collective work ahead to put the pressure on, light the fire. There's a lot of pragmatic tips on how to stay grounded in this deliberate weaponized chaos against us. So if you or someone you know is especially vulnerable to, we all are, but if you're dealing with cancer or anything else, and you really need our support on fighting for your healthcare, this is the conversation you want to listen to. Dr. Butra is happy to come back on the show. And if you have any pressing questions, send them to me and we'll collect them and I'll see what she has time to answer to help guide us in our work in protecting our healthcare. Very important conversation. I want to just give you a quick little insight as well on, like Nazi proligarch, like Peter Thiel, henchman, PayPal mafia, mafioso, Elon Musk and his Hitler Youth continuing to rapidly purge our government from within. It is a coup. It is a national security crisis. This is going to set off a bomb that not only impacts lives here at home but around the world. This is very dangerous. What's happening? I was digging through some old emails and I came across a pitch that I wrote when I worked at Condé Nast Portfolio. I pitched this story of what would happen, speculative, what would happen. And keep in mind, Condé Nast Portfolio was a glossy business magazine that covered the world of CEOs, the reigning gods of that day. And I was only working at this magazine because the one Christmas, my dad said to me, get a job and don't talk to me until you have one. And I thought I had a job. I was temping in offices across New York City, getting paid $15 an hour while working on my screenplay, buried at some desk somewhere in a skyscraper. Like I thought that was a job. But my dad was like, no, get a job that mom and dad and I can be proud of. And so, being a good immigrant child, child of immigrants, I spent Christmas Eve like, sending out my resume to a bunch of places and I landed at Condé Nast. And I'm so glad I did because I met lifelong friends, including a great group of journalists I just met up with this last night to commiserate, to plot world domination for the collective good. So here is my pitch from 2008 on what would happen to the world if a software engineer from Silicon Valley turned evil. And my focus was on Google because Google in the early years had launched a company-wide motto, don't be evil, which needless to say, they don't use anymore. And Google just rolled back its AI pledge. They changed it so that now they are going to develop AI for weapons. Great. All right. And so I saw this coming when I was a young kid starting out in a newsroom. And so back in 2008, I wrote, Google's founders pledged to stay together until 2024. That offers a sense of stability. But what about generations after the founders are gone? Will the company still stand on the side of don't be evil? To ensure that the personal information it collects can never be misused, has the company established a system of checks and balances strong enough to withstand market forces, government pressure, and, say, doomsday scenarios like a rogue engineer? Yeah, so that pitch never made it. Even though I was right, I saw the writing on the wall, and now our government is being destroyed from within by a fascist team of rogue engineers carrying out a coup. And what does this mean? Well, to get insight on the repercussions for this, look at what happened back in 2023 to 2015. China unleashed a massive data breach, a hack of the United States Office of Personnel Management, which carries all the records of federal employees, including deep dive background checks into, say, CIA agents and State Department diplomats stationed in China. I was at a conference in Prague in 2015, and I was speaking with some folks in the federal government directly impacted by this hack. And yes, it was Chinese hackers, but what those Chinese hackers did, their personal information ended up on the dark web, of course, and their social security numbers were being sold. Their credit was getting fucked up because of this hack. So, what everyone needs to do is sign up for something like Credit Karma. That's what I personally use. If you have something better, let me know. But track your credit closely, because what do you think this team of Musk idiots are doing? They're a bunch of little boys. They're breaking laws, and the criminally minded are magnet for other criminals that are going to latch on to this and grab what they can out of this chaos. So monitor your credit closely. And if you have strategies on this, write to us. Let us know what you're doing. You could reach me over Patreon. And that reminds me, this Friday, we have game night organized by a Gaslit Nation listener on Patreon. I will be there. If you want to join, I'm posting the link on Patreon. Find it there. 8:30 p.m. Eastern. We are playing Code Names, a board game. If you don't know it, neither do I, so you can learn with me. The whole point of game night is for us to settle our nervous systems a little bit and get together, hang out, and take our minds off of the coup and then get back to fighting it. So it's just a time to catch our breath. All right, everyone. Now here is our live tape discussion with Dr. Meena Butra with Doctors for America on how to protect our healthcare from what's coming. We are joined in this special discussion here on Gaslit Nation with Dr. Meena Butra, an associate professor of medicine at the University of Pennsylvania and a physician with Doctors for America. If you're wondering why marches still very much matter, I met Dr. Meena Butra at the People's March earlier in January. Gosh, this January that was like never ending. We're now in February. So I met her at the People's March. That is why we go to marches, to stand up, to meet like-minded people, to join forces together and build real power together. I invited her onto the show so she can talk to us about the important work that Doctors for America is doing, especially when it comes to protecting our healthcare. So Meena, I wanted to ask you, tell us a bit about Doctors for America, how you got involved, and most importantly, how do we protect our Affordable Care Act?
Great questions. And I actually want to start with just saying that I really appreciate folks who are standing up and speaking up, going to the marches, going out and canvassing, going out and writing letters, because I've been taking my kids to do this since they were old enough to not require the stroller, because I don't have the arm power to do that when we're out canvassing. And they think I'm their crazy mom. My son has probably he's 13 now, but over his lifetime, he's probably wrote over 10,000 letters to voters and probably 800 postcards to voters. And I can't even count how many houses we've gone. And now his younger sister, who's 9, who you met, Andrea, she does letters and postcards, but she's all about canvassing. She's like, I want to go knock on doors. But they think their mother is the crazy one, and that they're just doing it out by themselves until we go and we see other people. And when we see other people and other folks come by and say, thank you for what you're doing. I love what you're doing. I love your sign. I think it reaffirms to them that they're not the only people out there doing this. And especially coming out of the pandemic, I really appreciated having all the other people that they were able to see who were out there, that we're not living in an island. It's good for your soul. And to echo something else that somebody was saying earlier, when I get together with folks and we have these gatherings, and there've been a lot of them over the last many years, we always have like a glass of wine or some really, really good food. And because we always say fighting Nazis should be fun. You should go out there and have a good time with your friends, get them together, have a laugh, have like some camaraderie. It's really important. But to answer your question about what is Doctors for America, I'd like to tell a story because I think it illustrates a lot of these points and also the importance of the ACA. And the story starts back when I was in medical school. I'm not going to tell you exactly how old I am, but I was in medical school before the ACA. And there was actually an MD PhD student who was there who actually became life-threateningly ill with a serious incurable disease. And despite the best medical care, as an MD PhD student, this person was actually hospitalized for nearly 3 months and nearly died. And again, as a result, they took a leave of absence while they were hospitalized. Now remember, this is before the ACA. So their insurance company said, well, you're no longer an active student. We're going to drop you from your parents' insurance. The medical school very quickly reinstated their medical active student status with a $1 tuition, saying like kind of like a screw you to the insurance company. And the insurance company responded equally quickly saying, well, you have a pre-existing condition. So you have a cap on your annual care, you have a cap on your lifetime care, you have exhausted your annual cap. And they started calling, debt collectors were actually calling the student while they were in the hospital bed. And the student ended up dropping out of the PhD program because they said, I got to get a job. I've got to get health insurance. And the fastest way to do that is become a resident and get, health insurance as a job. Still had one extra year and went up to Boston. And while they were in Boston, at that time, Mitt Romney was governor. And Boston, state of Massachusetts, had a health insurance plan through Governor Romney that actually was very much kind of similar to what the ACA would become. And I will never forget my first doctor's appointment when I was in student health up in Boston, getting my master's in public. There was a my MPH. There was a very young Harvard student health doctor who saw me and ordered a million tests. And I was sitting there mentally calculating, oh God, I've got to pay my rent in Boston. I've got to pay the food. I've got to pay my tuition. And how am I going to afford all of these tests? And I remember he looked at me and said, what's the matter? And I said, I don't think I can afford all of this. Can you just tell me maybe 3 things that I need to do this month? And he's like, what are you talking about? You only have to pay the copay. And if you've never had to choose between paying rent or paying for your medications, I cannot describe the wave of relief that I felt. So when President Obama rolled out his idea for the ACA, for Obamacare, I paid more than just a little attention because I knew not only how much this would affect and be life-saving for me, but how much it would be affect and be life-saving for all of my patients. But I also noticed something else, that there was this band, and I don't know if anybody noticed this at that time, there was a band of these people in white coats who were showing up on TV and showing up on state capitol steps and writing these op-eds and literally had rented a bus and were driving from state to talk about how important the ACA was. And I watched them as a patient. I watched them in gratitude. I was like, oh, thank God somebody's out there standing up for me. As a doctor or a healthcare provider, I was like, wow, I have never learned to do what they're doing. I've never even seen doctors doing this before. I wanted to be like them, but I was too afraid because in the medical profession, you're taught to stay in your lane and not to do anything. But those doctors, they called themselves at that time Doctors for Obama. After the ACA passed, they actually turned into Doctors for America. One of the founders was Vivek Murthy. Another one was Dr. Mandy Cohen and Alice Chen. These were all the doctors who got together at that time. They were just interns, residents, fellows, new attendings, pooled their money, rented a van when they were off shift. They were writing letters and showing up at these state capitals to stand up for the ACA. So now fast forward to 2016, and I'm not ashamed to say that me and my then 5-year-old campaigned hard for Clinton. We canvassed, we knocked doors, we watched 538, and I've never felt as sick as I did the morning that night. But then the morning was worse because I had to wake him up and I had to explain to him the election results. And I remember putting him in the car seat, taking him to, his daycare, preschool, kindergarten. And he was so quiet and he didn't say a word. And we pull in the parking lot and I say to myself, God, I've got to talk to him about this. I go, sweetie, what are you thinking? And he said, Mommy, what's going to happen to the brown people and the women and the people who need to see a doctor? And I had barely been holding on to it. And I don't know how I held on to not crying in front of him. And we talked about how, he plays soccer. And if you lose a game, you don't quit playing soccer. You get back out there, you go to your practices and you play the next game. And he got all, and I said, we're going to go out there and we're going to keep working and we're going to keep standing up for these people because they need us to be there. And then I cried all the way to work. But I decided it was time to get off my ass. Up to that point, I'd signed petitions, I donated money, I was a member of DFA, but I'd never really done anything because, again, stay in your lane. I was like, nope, got to do something. And I had heard that Doctors for America was going to be at the Women's March. And so I got into a bus with women I'd never met before, put on my white coat, had my signs that I hadn't made signs since I was in elementary school, and showed up. And if anybody else here was there, you realize I don't think anyone was prepared for how many people were there. And it was impossible to get in touch with anyone. Your phone service wasn't working. And so I'm wandering around, and slowly I'm finding another white coat and another white coat. And pretty soon we've got a group of us, and something really interesting happened. People were chanting, "Here come the doctors, here come the doctors." And they were making way for us and telling us, "Hey, there's more doctors up there, up at the front." And they were letting us through. And at some point, this woman grabbed my arm, and I turned around, and she was this young woman, must have been in her 20s, and she was crying. And she said, "Thank you." Now, I tell people that story because I talk about how important it is for us to be standing up and how much it matters. I experienced that as a patient, watching these doctors stand up and talk and speak up for healthcare. And it still matters to this day. And that's what DFA does. It's now, I should know these numbers. I'm the vice president. The 21,000 members, not all dues paying, but all retired doctors, active doctors, medical students. It's a 501(c)(3). We are nonpartisan. We put patients over politics, and we stand up for three big interest areas: access to affordable care, community health and prevention, and health justice and equity. And within these include not just FDA or an FDA task force that fights for better drug pricing, but also improving access to affordable care, reproductive health, LGBTQ plus health, gun violence prevention, public health, immigrant health, all kinds of different groups within each one. And yeah, we're busy. This week has been a little bit tough for all of us, and we knew it was going to happen. And like you guys said, they brought it, and we're bringing it right back. We have filed amicus briefs. We have worked with Columbia law students. We have been in and out of both of congressional meetings, not just in Washington, D.C., but at the state level. We do everything we can to stand up for healthcare. And I think it's going to become even more important because we had a taste of what could happen in the first administration and what they would do. And if the last week or two have been any indication, they're better prepared, and they're going to come much faster and much more swiftly this time around. Hope that answered at least your question, Andrea.
Yeah, no, absolutely. So there's a question here from Jane. She writes, my daughter-in-law's oncologist is trying to reassure her that Memorial Sloan Kettering will protect their cancer patients when the ACA is repealed. If it is repealed, how can even wealthy hospitals like MSK protect their patients? The costs are astronomical.
Yes, it is. And I will say that part of I've had my patients in the office crying back in 2016, like coming in and crying because they were scared of what was going to happen. First of all, I don't know how much protections there can be. There can be protections for some things. There will be some benefactors. There will be some charity grants and trusts that can cover some drugs, but they're not going to cover everything. And medical bankruptcy is a really real thing. I have experienced it. People have experienced it. This is going to be a problem. I also think that the Trump administration is going to be smarter this time. We're seeing this with what they're doing right now. They're not going to talk about repealing the Obamacare ACA. They know how unpopular the word repeal and Obamacare and ACA are when put together, because people came out in droves. In the wake of their prior unsuccessful repeals of Obamacare, they chipped away at it. And they chipped away in a myriad of different ways that can affect you above and beyond just one single disease or one single drug. So for example, they cut all advertising for open enrollment. They cut all the navigator assistance. They allowed junk plans to become an acceptable alternative to the ACA plans. These are typically lower cost plans, so they draw folks away and result in increasing the cost of the current ACA plans. They can cut or decrease incentives for Medicaid expansion. They can allow the Biden subsidies to sort of expire. Biden had some of the best new subsidies that have gone into effect that have allowed us to enroll folks on the ACA. And the uninsured record is at a record low right now. But they're set to expire, I think, at the end of this year. And if they expire, then that would mean millions who could not afford a plan. And then they can weaken patient protections. And we're already seeing some of these court cases coming through. And these are some of the things DFA is taking action on. The Trump administration can stop defending Obamacare. against lawsuits that don't want to cover patient protection. So for example, lawsuits saying we shouldn't have to cover preventative services like cancer screening, like alcohol counseling, like suicide or mental health coverage. About hundreds of millions of people benefit from this. We've seen really incredible advances in being able to detect cancer at an early stage in this country as a result of this. But if these lawsuits go through and the current administration isn't going to defend Obamacare, then we really do have a problem. And I want to make a point that this doesn't just affect the folks on this call or the folks we know. This affects everyone. And my patients, I never ask them who they voted for, what their political affiliation is, because it doesn't matter. When they come in, they're scared. It's health. Health does not care what your political affiliation is. Health does not care who you voted for. Health affects everyone. And in that way, it actually makes it a great topic to bring people together on all sides, because you're speaking a language everyone can understand. So when you talk, and this is why they will not say the word repeal with Obamacare, because they know that that is going to be unsuccessful. That's why we have to make it very clear that when they're chipping away and doing these little tiny things, what does that mean? When they let the subsidies expire and they don't vote on them, it means that 150 million people will not be able to afford healthcare in this country. When they don't allow Medicaid expansion or not giving incentives for Medicaid expansion, that is tens of millions of people in every single state, usually the most vulnerable, the most poor, who will not be able to afford healthcare. You put it in that context, you're not saying anything about politics. You're talking about something quite literally everyone can understand and come together on. But yes, it will be worrisome and it will be frightening. And I think because health can bring people together, it also makes it a really great mobilizing. And the way we fought it the first time was people drowned their congressmen and senators in phone calls. People showed up in those offices. People wrote those letters and told their stories, and they put them out on every social media platform they could. And it put all of these folks on notice that this was going to be a problem. And remember that while they do hold all three, whatever, the White House and the Senate and Congress, they don't hold them by that big of a majority. Especially in the House, it just takes a couple of people and reminding them how many folks in their district, how many folks in their state are going to get affected by this, because this is a real thing. I don't have like great solutions. I am not a policy wonk or a politician or anything like that, but I will say that there are a lot. I remember in the first administration that actually, like a couple of years ago, this woman I've never met and never meet again, sent me just a picture, and she said, just so you know what it means to folks like us. And again, never met her before, but she said, I found this in my husband's phone when he was getting a new phone, and it was a picture he had tweeted out during the repeals that he goes, my unborn son will need major heart surgery within weeks of being born. I think about the particulars of health insurance a lot more now. And apparently I had responded and said, you focus on mom and baby. Good people will continue to fight for your son's healthcare and we won't give up. And he had taken a screenshot and kept that all of those years. It makes a difference when people stand up. It really, really does. And it can change the trajectory. That little piece of gratitude that you care, no matter who they voted for, that you understand, it can be that connection that can cause people to really rethink how they feel and what they're thinking about.
Okay, so can the states, like, let's say the worst case happens and they're chipping away at Obamacare, what can the states do? Especially if you're like, can we pass single payer in the states? Can we strengthen our healthcare within the states? Can the Obama regime, like the Trump regime, interfere with that?
There are some things that states can do, and it will be hard. So states that have passed Medicaid expansion, they can continue to keep that in place. They may not, there may be caps on how much money that they're now getting, but they can keep that in place. The problem is the states that haven't passed Medicaid expansion, for example, will have no incentive to do so at this point. Some states may, it'll be a budgetary issue. Really, it will be a budgetary issue. And the other problem is that these are health insurance, plans, health insurance companies. And so during the first repeals, a lot of the health insurance companies came together and said they are hiking up the prices on the silver plan. We are going to actually lower the prices on the bronze and the gold plans. So folks who are on the silver plan can move to these other plans that might actually be cheaper for them and get better coverage, just because they understood that people were not going to be able to afford healthcare and they didn't want to lose these folks on their healthcare plans. So I imagine that there will be some of these attempts. The problem is they get complicated. People don't understand them. The word doesn't get out and folks just think, well, I can't afford this. I'm going to go without. Or, hey, I see this bright, shiny, really cheap plan that just happens to be a junk plan. I'm going to just sign up for that. And then when they get sick, they have no coverage at all. And so I I do worry about this. I worry about it a lot because I think that the lower information voters, the folks who may not understand all the intricacies of this, um, they're going to have problems, and states will be really, it'll be really hard for them to reach everyone and to get the word out. Because as I think I heard, I joined late, I apologize, or early for my time, but how we are able to communicate and get communications effectively to folks is a little bit difficult now as well. Um, at DFA, Doctors for America, I have remained committed to posting on all of the media platforms. I don't have to interact with the folks, but I got to get the information out to where people are. And that means, you know, if there's, and we did this during COVID too, because we knew that there were a lot of folks who were anti-vaccine, but they weren't anti-vaccine, they just were confused and scared and didn't know what to do. And if you could meet them halfway, you could at least put that seed in their head. Hey, this is something I should think about. I'm going to talk to somebody about it. Maybe I can reach back out to this person and get some more information. So putting the information out in all of these places, letting them know not only the harms that are happening, but also the places where they can go to maybe get assistance. They work. We did this when the navigator assistance and the open enrollment advertising was cut. We did the grassroots advertising for free. And people did that at the state level. When they cut navigator assistance in Iowa, there was 0 navigators. West Virginia came to they were like, we got a couple of navigators, they'll help enroll the folks in Iowa as well. And we got the phone numbers to people in Iowa so that they could get a navigator in West Virginia, for crying out loud. I mean, we shouldn't have to do that in this country, but it is what people do. And that helps folks know, I got to listen, I got to pay attention to these people, and makes them stop and think about maybe some of the misinformation and disinformation that they're hearing about. Um, I don't know if that answers your question. And again, I think states are already thinking about this. I think we did learn, but I do think it's going to be hard to cover all of the folks, and certainly hard to cover people out of state, because that was one of the beauties of Obamacare, was that your plan was your plan. And I'm not sure, depending on what gets chipped away, what level of protection folks have.
And you can always send me messages to run on this show, like updates, calls to action, anything you need. I'm happy to broadcast that out to everyone because this is a very urgent issue. So I got a message from a listener that couldn't be here, but she wanted to know, she's a psychiatric NP and works with children and adolescents, including many vulnerable and at-risk groups. She's wondering if do you have any recommendations for agency policies to protect these client groups and families? Also, even though our records are very much protected with HIPAA, I imagine we need to minimize what we document in the chart about gender identity, sexual orientation, even birth control, just best practices related to this. Thanks so much.
So first of all, I will say there are 2 court cases coming up through Texas challenging HIPAA. If you haven't heard about this, you gotta love the state of Texas. No offense to anyone who might be from Texas on this call. The first one, there are 2 HIPAA laws that are at risk here. The first one was a Biden HIPAA law in the wake of the Dobbs decision to protect access to reproductive charts. This is one that is going through the Fifth Circuit and everybody's favorite Judge Kaczmarek. And so I have no doubt it will make its way to the Supreme Court at some point. The second one is actually the state of Texas suing to not just repeal that HIPAA law, but actually the 2000 HIPAA law that covers all of HIPAA. This would actually make all records of, like, potentially available at the request of whomever. This is Ken Paxton, the state attorney general, and in the state of Texas. Now, DFA is actually partnered with Democracy Forward. I hope I'm getting that correct, to fight back against these. But I do, again, these are flying under the radar. If you haven't heard about them, this probably means that people you know haven't heard about them. And this affects everyone. And this is the sort of thing that people need to know. DFA is mobilizing doctors because we're going to be really upset about this. And I got to tell you, doctors don't know either. We're getting flooded and it's overwhelming and there's too much. But this is the sort of stuff that is really easy to call your whoever and say, look, I don't want a political office in the medical office with me and my doctor. This is my own personal medical information. Don't, I do not approve of this, because that's something that affects everybody. So there are going to be challenges to the HIPAA law. I, as a physician, cannot, it goes against everything in my grain to tell somebody to not disclose medical information, right? Because we do need to know. And if we're not a safe place, then what is a safe place? DFA is working to we've put together toolkits already for doctors about how they can protect their immigrant and refugee populations and what are the things that we can do to protect them when they're seeing us, when they're working with us, and what information we can give those patients or people to protect themselves. I have no doubt we will be doing this as well with what we can do to fight back against any kind of HIPAA stuff or HIPAA challenges. But in the meantime, I hear people talking about how not to disclose if you've had an abortion or if you like all of these things. And this goes against the grain of who I am and what our profession should be, because I can't take care of patients properly if I don't know some of this, but I understand that. And I don't have great answers. I really don't. I think a good place to start is to ask the doctor, what can I tell you safely? What is truly confidential between us and what could potentially become public. And that is going to vary state by state, actually. And I think certain states already, we've seen, for example, in the state of Tennessee, that they have just given their records over to their state attorney general in some of these hospitals. But in other states, absolutely no, that's not acceptable. That will not happen. And this is a fight that's playing out in New York City right now. That doctors in New York, not New York City, but New York, the state of New York, the state law protects providing transgender care, but the federal law now says that you should not be able to provide transgender care. And so doctors are like, what do we do? What are we supposed to be doing? This is going to be a fight where there's going to be a lot of gray zones. And I think if there's a patient, the first thing to do is just be really upfront with the physician and say, I need to know what do you know can stay truthfully here in this office between you and me. And if the doctor doesn't know, then you have to make a decision about what you're comfortable with having out there, because it is possibly something that is could be potentially turned over to some other place.
Let's talk about bird flu. So obviously, Trump was hit with the pandemic. He tried to wave it away. He weaponized support for it against against the so-called blue states. There were reports of Trump supporters in denial of the pandemic, even as they were being incubated. It's a horrific story. Like, he mass murdered several of his own supporters through his disinformation.
I took care of those patients in the hospital. You gotta love it.
Yeah. So we're heading back into that because we're seeing coals of flocks and the price of eggs going up. And so for the love of God, Mina, like, how do we protect ourselves if there is a full-on blackout between government agencies, these agencies, and the public? It's far worse than before. Like, he will like Soviet Union us when it comes to the information blackout.
Not to scare folks, but it's already worse. Entire data sets are disappearing now. If you haven't heard, from the CDC, from the NIH, the NIH and CDC are not allowed to talk with external folks, so we've had to cancel grand round speakers. I can't get in touch with my program officers for some of my grants. Data sets about surveillance data sets, guidelines on how to give contraception health to women, how to prescribe HIV medications have all disappeared from the website. It is scary. And at the same time, they have learned and we have learned. So during the pandemic, we had the same thing. There was absolutely no public accessible data set of how many patients had COVID or where it was. What Johns Hopkins had a big map that they kept track of everything. And actually they were getting the information from journalists who were going to hospitals and getting reports from doctors like us saying, this is how many people we've had, and these were estimates, but that was how we did it. And we all worked together to put these together. Already in the wake of these data sets disappearing, I can't tell you how many folks we're actually getting overwhelmed with how do we put together everybody who says, I've got an archived data set, I've got the data saved, I've got this, I've got that. What do you need? I'm going to give it to you. We're going to put together. There's going to be 1 million of these archived data sets that are coming together because people are like, you know what? No, we know this is going to happen. We're going to take care of it. It is still not good. This is extra effort that we're tired. We got a lot of stuff to do. We don't need, and we do need to know. There was an outbreak of tuberculosis in Kansas. I don't know if anybody heard about this. There was a whole outbreak of tuberculosis in Kansas at the same time that the Kansas, I want to say state legislature, I may be getting it wrong, wants to outlaw any kind of mask mandate in public settings. Those two are not compatible with good public health. But and these don't make the news, and it does make it harder for us to do our jobs, because if someone who comes in and is sick and we don't know where bird flu is or where these peaks are, we're going to have to act as if the way we are taught to act in kind of crisis situations, which is assume the worst, spend a lot more resources, a lot more time, a lot more expenditures to make sure it's not the worst before we can assume, oh, it's just flu. It's not actually bird flu. Two very different things, two things we have to treat very differently. We can do this. It is not going to be easy. It is going to be time consuming. There will be cracks. There will be mistakes. These are the things you as non-doctors can call and tell your congressmen and senators about. You can tell them that you want this data to become publicly available. You can tell them you want the CDC to be able to put out public health alerts and let the hospitals and states know and public health departments know if there's an outbreak of this, of whatever is going on, because this could be affecting your state, your district, your hospital setting. And we're doing it, but this is not just our fight. This is everybody's fight. And this is, again, the sort of things that people can come together on because it affects everyone. The sort of things you could be doing right now. And by the way, I just recorded, I have real work. Believe it or not, I'm a doctor and scientist, but I just recorded a whole training session for doctors on how to call their senators and congressmen, because we're not used to having to do this all the time. I was like, as little as 100 calls can shut an office down for a day, because they have to log every call and they have to log every topic. And these folks pay attention. And even if you see a public vote that is not the way you want it to, that does not mean, if the pressure is high enough, that they're not making some kind of backroom deal saying, look, I will vote for this, but you're going to have to cut me some slack on this ACA stuff or whatever else, because, oh my goodness, my constituents are angry and they're paying attention. And I've got an election coming up and midterms are coming up in 600 some days. I'm going to need some help. And so this is how we make sure that we're holding them accountable. I'm seeing like 60 new messages and I'm so afraid to look at the chat right now. I'm going to actually just drop in my, in the chat, just my, may live to regret this, but I'm going to put my social media accounts as well as I can remember them, and feel free to send me questions. I'm not afraid of answering stuff. I'm also not afraid of muting crazy people if they're bugging me. So I have no fear anymore. But please, any other questions? And I apologize if I'm not getting all of them or I'm not
No
answering.
worries. Yeah, no, this is a hot topic. And so I wanted to ask, is there a vaccine for bird flu? Are we ready for that?
We're not. And I will also say that now there is, not to scare anybody again, but if you're anxious, earmuffs. There's an Ebola variant globally that the United States was doing research, collaborative research on. Now that funding has just been stopped, frozen. So there's a lot of freezing cycles right now as well. If you haven't heard, I actually have two shouldn't say this publicly. I have two grants where we may have some diversity and equity aims, and we have gotten official notice on Friday evening to cease and desist all equity work on one of them, and I have absolutely no doubt that the other one I will get an alert sometime this week. So there are a lot of freezes on funding, a lot of questions on funding, and a lot of fear. So even if we haven't, people are pivoting right now because they are worried about their funding. Again, not productive to helping people. There are maternity centers that have basically shut down or have started to decrease services because they preferentially take care of Black populations, and they are worried that they're going to have all of their funding taken away because of equity, which no equity-based care or research is allowed to be done right now. This is crazy, and this is not how we should be practicing medicine.
It's a form of genocide, I would just say, when you target a
It,
group like this for life-saving care.
yes, it is absolutely insane. And again, this does not affect one side of the aisle. This is something everyone can call and talk about. These funding freezes, these funding scares, these intimidation tactics, they just decrease people who are doing the actual work. And they put freezes on the funds that are actually out there right now. And that's bad. That is bad for health. That is bad for communities. That is bad for everybody at all levels.
Yeah, they're weakening a massive amount of the population, but we have to stop this. So I wanted to ask, so bird flu, Ebola now, the US is pulling out of WHO, it looks like.
Yes.
And where does this leave us? Just vulnerable to pandemics? The climate crisis is supposed to make pandemics more frequent. How can we as average citizens monitor this? Like, what are the websites, the apps, anything like this? Like, what's the sort of the canary in the coal mine we should pay attention to?
Please, please, please. I am a big advocate for following local journalists, independent journalists. They are doing the Lord's work out there. Do the same for doctors and scientists. Please, please, please. We don't have large followings. It drives me crazy that Tom Brady can say that drinking water can prevent sunburns, and he's got millions of people who follow him, and he gets away with that. And I'm sitting there with my couple thousand people going, no, that is not work. That's not how it works. And nobody's paying any attention to me. But it is absolute. And yes, there are bad doctors. There are a couple that are running for head of CMS, but there are really, really good ones as well. And this is where learning how to sort of sift through mis and disinformation is important, but also uplift those scientists, uplift those doctors. We don't get a lot of traction, but we're trying. We are actually putting ourselves out there and trying. And I take a page from, I mean, I don't agree with a lot of things he's done in the recent, but I did work with the Fetterman campaign when he was running against Doc Oz. And one of the smart things that he did was they had a lot of training sessions they called them the 60 and older club. Come to our training session on social media. And all they said was, you're on Facebook, you guys. You're going to follow us, and every couple days come in and just like and share everything we've posted. That's all you have to do. You don't have to post anything else. Just like and share what we've posted, because that was how, with minimum money, they were able to beat the social media algorithms and uplift all of their messaging and get it spread to different circles that they wouldn't have already got into. It was brilliant and smart. And we're trying to do that now with, in the medical and in the science circles by saying, hey, follow these folks, uplift what they're saying. You don't have to post. You may not be the best person at posting, but uplift what they're saying, because the algorithm just looks for interactions. And if interactions are there, great. But I do think that we're going to have problems I know a lot of public health departments, even before this administration, but in the wake of COVID, got doxxed. They would try to put out something and their comments would just get slammed with anti-vax, anti-science folks. It's happened to me as well. And that makes people, we've actually seen huge decline in people working in public health workers. And so it's going to be hard to get good information. The other thing I'd say, it's easy to say, talk to your doctor. In this country, we don't make healthcare free. Not everybody has access to doctors. I am always and have always been very, very happy to answer questions during the pandemic. I had tons of people I never met ask me questions about vaccines, ask me questions about COVID, and I would do my level best to answer questions anytime I could with them. Um, and there are more and more like us who are out there. So you feel free to reach out. Maybe we don't respond right away because we're a little bit busy and a little scared of social media sometimes, but we're working on it. We're trying to get there. But it's going to be a grassroots community effort. It really will. But you're not alone. And it's not a time to get fearful and think you're going to die, because there are really, really good people like us who are out there trying to do this. And follow Doctors for America. That's an easy one. And anybody who's at Doctors for America, follow their social media accounts. We're all good doctors trying to do good work and trying to promote science. And then look for who we follow and follow them, or who we're uplifting. And that's a good way to kind of get a cycle of who you should be following and where you can get good, trusted information, if that makes sense.
Thank you so very much. And you have a request in the chat to start a Substack and to
Oh
be
gosh.
on Blue Sky. And I'm going to ask you a lifestyle question. Oh, wait, one quick question. What is behind the tuberculosis outbreak in Kansas?
My best guess, I've reached out to a couple of folks I know there, and I know that they're really busy right now, so I haven't gotten all the answers on that. But my best guess is that it's like a measles outbreak, and that there are probably some immigrants or somebody who came who was exposed. And tuberculosis, just so folks know, wearing a mask is very, very effective, because you actually do have to be within like inches to a feet for a prolonged amount of time to actually get enough tuberculosis to get sick. Wearing a mask is very, very protective. What scares me more is the anti-mask movement that's out there. I don't care if you wear a mask. That should not bother me. Let's not go hunting out and making people who do wear masks feel like they can't, or that they can't be masks in indoor events in public areas. Because it will actually protect folks. A lot of my patients are immunosuppressed, and they do need to wear masks for any number of reasons. We've had measles outbreaks as well for the similar reasons, that you have people who maybe didn't get their vaccines for one reason or other, or came from a country where they didn't have access to vaccines, and now it's spreading. And because we have so many anti-vax or unvaccinated folks, it spreads even more quickly. And it's very contagious. Measles is arguably the most contagious thing that can be out there. And my patients are so frightened and so scared about getting it, because if they're immunosuppressed, they can't get the measles vaccine right now. And so public health is so important, and I don't know that folks really truly appreciate how important it is. But I do think that it is the kind of thing that these should get contained. There should be the CDC would work with the local public health department to say, this is what we need to do. This is where it is. Report the cases back to us. We're going to get you the information that you need to get. We're going to help you do the contact tracing, because we know you may not have all the personnel, and we'll contain this. When you break that chain, which is what's happened now, is when problems become much, much bigger.
I want to ask you, I know you've given us so much time, and we appreciate that. Is one final thing. When Trump was inaugurated the first time, January 2017, I bought N95 masks that would unfortunately then come in handy. Now my instinct is telling me I need to talk to my property manager, my condo board, about fixing the ventilation in our building and making sure that we're ready. What
I think
is the
ventilation.
case for that? Sorry, go ahead.
Oh, no, it's okay. I think ventilation is something that's really important. We learned a lot about ventilation and appropriate ventilation during the COVID pandemic, and especially my kids were both in school at the time of the pandemic. And how were the schools being ventilated? How was the ventilation working? How old was it? These were all concerns that we had. I think of it, and this was an analogy maybe some of you all would be familiar with. the Swiss cheese sort of idea. There's not one thing that's going to be the right thing. It's going to be multiple layers of protection so that even if one is just a little bit imperfect, you're going to be okay. So you can fix the ventilation in your home, but you're going to the grocery store, you're going to the library, you're going to a shopping mall or wherever it is. You don't know or might not always have the control over that ventilation. But if you're wearing a mask, then you're going to be doubly protected. If you're wearing a mask that's got multiple layers, then that's additional like sort of layers. And the analogy I used during the pandemic when I talked to families is I'd say, you check the weather report and you go out there, and if it's just a couple of light drops, maybe you just throw on, your raincoat. That's it. It's all you really need to do. But if it's a downpour, you're going to put on your boots. You're going to put on your long raincoat. You're going to put on your umbrella. You have multiple layers so that on the inside, you still stay dry when you get from point A to point B on wherever you're trying to go. Now, that also depends on us having a good weather report. And this is where the CDC comes in so useful, right? This is where public health comes in so useful. So we can know what the weather report is. And that's going to be a little bit of a breakdown, hopefully not for very long. Hopefully we can convince folks that this is really important, that they at least let people know what's going on in their respective areas. But in the meantime, the whole idea, the same idea sort of like, still exists, that there are multiple layers that you can take when you're out in public to protect yourself depending on what your situation is, and what your risk factors are.
For folks in buildings, though, if I'm smelling my neighbor's cooking, or they just just painted their apartment, I can smell the paint fumes coming in. Does that mean that our ventilation, that we're at risk of airborne viruses? Like what?
Viruses are a little bit different, and not, we do have a good immune system, and we have built up immunity over time to a lot of things. A perfect example is this past week. It was like a little petri dish with my kids. They picked up whatever the heck is going around at school, and they were sick and spiking fevers. And interestingly, my husband and I barely got sick. And I told my husband, I'm like, we're sitting here and they are like, my daughter just wanted to sleep with me every night. I was like, this is great. I'm going to die a slow death from this. And I was fine. And I asked him, and he's like, we have a historical immunity. We've had a lot of time and a lot of exposure. They haven't. In fact, my daughter probably the least amount because she was so young during the pandemic and was actually kept home a lot more than her brother and didn't have a lot of that early immunity that he had. But you can buy room filters. We actually did this in our house. We have them in our the building at Penn. The buildings are very, very old and really need to be burned to the ground and rebuilt many times over. But we did buy these really nice room ventilations for the conference rooms and the common areas in each one of these rooms, for specifically that reason, that we couldn't control the building ventilation. That's too hard, too difficult, but we could actually have something in the rooms that would help out. And during the pandemic, when people were getting COVID, I would tell them, this is one of the things you could do if you're trying to separate family members out, is to have that ventilator in, like, wherever the rooms are, that the public rooms, keep them as isolated as possible, but they're going to have to go share bathrooms sometimes. That's just the nature of what's going on. They're going to have to go to the kitchen sometimes. So you have that in those areas to help, as well as them, potentially wearing a mask along those lines.
Thank you so much. It is such a pleasure to hear from you, and we will follow you on social media. And I'm thinking of doing maybe on the show every week or every 2 weeks, like a weather report on the pandemic watch, and just
I
let people know.
I will be happy to come on as often as I can. I am not the smartest person in the room. I know smart people. That is my superpower talent, is I know smart people. And I made all the mistakes all the time. I failed at everything. I made all the mistakes, and I know smart people. So this is why I think I'm only uniquely qualified. But I'm also happy to answer any other questions. And listen, right now, what folks can do, I know there's a lot of people who reached out to me and said, what can I do? I feel helpless. I feel hopeless. You can make calls about what's going on. You absolutely can make calls about what's going on, about the freeze, even though it's temporary on Medicaid, about the lack of communication from the CDC, about, yes, RFK Jr., I saw that name somewhere in there, and Dr. Oz, who are just a danger. By the way, RFK Jr. actually said that Black people need to get vaccinated in a different schedule than white people. And that is not just wrong. That is taking us back to a dark, dark time in medicine that has led to the racial inequalities and disparities and bias in medicine already. And this has kept me up at nights, my fear and my concern about this. This is exceedingly dangerous, exceedingly, exceedingly dangerous. You have agency. Everyone here has agency, because this is not just a doctor thing. This is not just a scientist thing. This is a you thing. This health affects every single person here. So we have a little like call calendar. All the doctors are busy, but we're going to call at least every day. A doctor from the state of Pennsylvania, and our Pennsylvania chapter calls our senators and leaves a message saying why it's bad. And with your friends, say, okay, we're going to do a rotation, and every single day, one person is going to call, write out a little script, couple facts about these people, about why it's bad, and people are just calling and leaving messages, because that keeps up the pressure on everybody. And have fun fighting Nazis. That's my last piece of advice.
I wore a tiara just to talk to you.
I love it. Thank you guys so much for having me on. I really, it's, we don't get a lot of, as I told Andrea, I was like, we don't oftentimes get uplifted, and it's really helpful to be able to do it.
We're all going to follow you. You have a whole bunch of new followers, a Substack request if you have the time. And another reminder, like, go to marches, because you're going to meet amazing people like Mina.